Hi, so my name is Dr. Hatim ABDULHUSSEIN. I'm a primary care physician in London, England, and I also work as our national clinical lead for AI and digital workforce at Health Education England. And Health Education England is a body that's responsible for training, recruiting, workforce planning of all health and care staff in the NHS, the National Health Service here in the United Kingdom. But Health Education England is responsible for that workforce within England itself. And on top of that, I also work for an organisation which is responsible for health innovation called Academic Health Science Network in Kent, Surrey, and Sussex as their medical director. What I'm going to be talking about today is how here in England we are preparing our workforce for AI. And I'm going to talk a little bit about something that a piece of work that we published in January of last year, which was the AI roadmap, which looks at currently how many AI and data-driven technologies exist within our system and how they are impacting on our workforce. So the first question to say is, why are we looking at this? Well, in 2019, we published something called the Topol Review. The Topol Review was led by a guy called Professor Eric Topol, who is a director of the Scripps Institute in America, and was asked by our Secretary of State or Minister for Health to look into how we can prepare our NHS workforce for a digital future. And as part of that, started to look at what types of technologies might impact the NHS workforce in the future, and made some clear recommendations, particularly around AI and data science, that the NHS should create and increase the number of clinicians, scientists, technologists, knowledge specialists who have dedicated time and opportunity to work either in academia or within health tech or within the NHS itself to design, implement, and use digital AI and robotic technologies. And when we developed our business plan for 21-22, we made clear that this aligns to what we're doing in terms of transforming today's workforce so they can be agile, flexible, multi-professional, and digitally enabled for the future, and adapt our education and training structures so that we can allow our workforce to adapt to change and roles as a result. And essentially, the essence of this is doctors, nurses, paramedics, physiotherapists, all of these healthcare professionals are not going to be working in the same way in 10 to 20 years. They're going to be working differently. They're going to be working with new technologies. They're going to be enabled by new technologies. And therefore, we need to think actively about how we make sure we prepare that workforce for working effectively with these technologies to ensure that we deliver the best patient care that we can hope for. So I want to start by a brief definition of how the Topol Review defined AI, and that was a broad field of science, which encompasses not just computer science, but also psychology, philosophy, linguistics, and other areas. And therefore, at a very basic level, it's getting computers to do tasks that would normally require human intelligence. The report also talks about digital medicines, and digital medicines are products and services that are used in diagnosis, prevention, monitoring, and treatment of disease. And that can be a whole host of technologies. And we've seen many of these technologies impact the way we work actually right now. And examples are telemedicine, smartphone applications, wearable devices, and other softwares that we might use to prescribe to input healthcare records, as well as extended reality technologies, which are emerging, particularly in the education space. So we've developed something called the DART-ED program in response to the Topol Review, and that's called Digital AI and Robotic Technologies in Education. And we focus on three key areas. The first is the impact of AI and digital healthcare technologies on education and training. We work with a range of key stakeholders. The second one is looking at robotic surgery and how we prepare our surgeons for the future, because as you can imagine, in the future, surgeons are going to be doing more operating with robotics. Just as surgeons move from open to closed surgery in the past and laparoscopic surgery, we need to make sure that they have the skills that they need to be able to deliver and develop that surgical skills using robotics. And then finally, we also did a piece of work with the British Association of Dermatologists to try and focus on dermatology in itself and how we make sure that we prepare dermatological digital leaders who can deal with skin conditions, particularly because telemedicine in particular is a key area in dermatology. Assessing a skin lesion, assessing a rash over the photo is a much more different experience to assessing people who might be in front of you. But it's a technology that allows us far more opportunity to see a subset of patients to be able to triage and identify which patients are more urgent than others. And therefore, it's a technology we should be looking at. The approach that we've taken here in England is to do some clear horizon scanning. So moving on from that Topol Review to really understand what technologies exist and what impact they're having. At the same time, we're moving on from that and trying to be proactive. because we want to know what people need to know already, so we can start embedding some of that educational foundation. And therefore, it's about assessing what the learning needs might be as early as possible and be able to act upon them. And then finally, those two steps lead to the key step, which is delivering the education that we need for health and care professionals around AI. And so as part of that horizon scanning work, this is where we decided to work on refreshing an AI roadmap. And what that means is really understanding what AI and data-driven technologies currently exist in healthcare here in the NHS, what taxonomies they sit within. So what types of technologies are there? What's their spread and adoption, and how they might impact on our potential workforce so that we can do the workforce planning around it. And we started this work in 2021. We started by looking at the data sets of kind of technologies where they exist, and that included something called the State of the Nation AI survey, where enterprises actually answer a survey that are developing technologies in the space to give us an idea of what's coming, or the National Institute of Health Research Horizon Scan, which is a horizon scan of all evidence, emerging technologies in this space, and other data sets. And then we looked at gaps and limitations, kind of what the evidence that was being put forward. And we started to create these taxonomies that we then determined which technologies sit within. And then off the back of that, developed a template for the database, thinking about what impact on the workforce might be and what horizon scanning would be needed to be able to populate the database. And then finally, we built the database and the case studies to understand what technologies are out there, where they are, and how they impact. And we found that, you may not be surprised to hear, that 34% of current AI and data-driven technologies, of which there was 240, were diagnostic type technologies. So these are technologies in the space of radiology, or in the space of pathology, or also other type of diagnostic technologies. For example, Healthy IO, which is a technology which allows your urine to be checked for any sign of kidney disease. There's a growing amount of technologies in the automation and service efficiency space, and this is really important because we know the workforce are currently overburdened by administration, by activity. I'm a practitioner, and I am always juggling. So if we can automate and increase efficiency of the way we do things, then perhaps we can release those pressures on the workforce, because this is a global challenge. We have an aging population throughout the world, and therefore we need to be able to care for that aging population. So it's wonderful that people are living longer, but you need to have the right care needs, right care set up, the right hospital structures, and also need to be resilient to the impact of a pandemic, for example. And therefore, if we can automate and increase efficiency, that's only going to do us justice. But what I find really interesting is the growing amount of technologies in the P4 medicine space and remote monitoring. This is the reason why this is interesting, because the Topple review looked at creating a future where we develop a healthcare system that's safe, ethical, rational, and tailored to the individual. And this is something that we can do through technologies that allow people to care for themselves at home and support themselves at home, whilst also having the right support that they need at the right time, if needed. And this is where AI and data-driven technologies can really help in terms of remote monitoring type technologies for chronic disease, for example, diabetes, asthma, etc., or even mental health conditions, or population-driven technologies that help to prevent disease or personalize to the individual, and help to improve the population's health, help to improve people's health on a wider scale. Finally, there's a small amount of technologies that are therapeutic. These tend to be in the mental health space around cognitive behavioral therapies, and then 2% were unclassified. We looked at how soon these technologies are going to be deployed. And when the Topple review was published, it talked about AI and data-driven technologies affecting the healthcare system within the next 20 to 25 years. But actually what we found is 80% of these 240 technologies are ready for large-scale deployment within 5 years, which I think is incredible and shows how far we've come. We then started to take a deeper dive into the types of workforce groups that are affected by the use of AI technologies. Again, you won't be surprised to see at the top of that list, you've got radiologists, and then you've got general practice or primary care. Then you've got our non-clinical staff, radiographers, cardiology, and below. It's important to note that this is a very basic level of the data that we collected shows that this is one of the primary groups that would be targeted for the technology. That does not mean that we're going to replace radiologists, but it means that then these radiologists might be working differently, or people in primary care might be working differently. And so let's try and explore that better in the future. We also looked at spread across England in terms of where these technologies exist. This is really important because we found the majority of technologies tend to be in clusters, in hubs. You won't be surprised again to hear that the majority of technologies are in urban areas, so London, for example, or in areas like our cities of Birmingham, Manchester, Leeds. And very few technologies actually were being built in rural coastal areas. This is important because our rural and coastal communities are often the ones that are struggling with health needs the most, and therefore the ones that need to be supported the most. So we do need to look at maturity, we need to look at adoption, we need to look at spread, and we need to look at how we can support organizations across our country to be able to be ready for AI and data-driven technologies and create the right infrastructure for that. And I think this has relevance to the global community as well, because you need to look at your populations and say, what do we need to do? What currently exists within our area? What do we need to do to spread equity? Because ultimately we all hope for the quadruple aim, which is to deliver a health and care system that is fair, equal to all. It's built on population health, it's built on patient experience or people experience, it's efficient, and keeps people working within the system, delivering that care well. And so it was a collaborative effort across multiple organizations within England. And I think that's one of the key things to put across is collaboration is key when you're looking at AI, because it's an emerging field, it's a growing field. And therefore you need to think about all the relevant factors to bring to the table. And that includes strategy. So we had the NHS AI lab support this work and their head of AI strategy. It's about innovation, research, and life sciences. So we're working with our National Institute for Clinical Excellence and our Accelerated Access Collaborative, which are organizations which help scale, adopt, build regulation, build regulation and standards for the technologies that we might be using. And coming together, it helped us to start to plan where we go in the future, because now we know what technologies exist. Now we know what their workforce impact might be. Now we know what areas they sit within. We can start planning to support all of the factors needed. And we've done a piece of work where we looked at how do we build confidence in AI technologies amongst people working in health and care. And we identified 3 key levels of confidence. There's a bottom layer, which is that national regulation, the national standards, the national focus on liability to make people feel comfortable. Then in the middle, we kind of go closer to that regional, local level, so local validation of data sets, making sure it's right for the population that it might be used for, making sure the culture within an organization is ready to use AI. And then finally, what does it mean for me as a GP, primary care physician, working with the patient or the person in front of me? What impact does it have there? What does it mean for my own liability? What does it mean for the types of cognitive biases that affect my decision-making when you've got an AI tool which is coming in and supporting your decision-making? How does that interplay work? And so it's important that we consider all of those aspects when we think about driving AI and think about the workforce right from the offset and create the right ecosystem that will enable AI to flourish in a health service. And so it's important that the final point for me to say is to take the workforce with us. And I mentioned that piece around learning needs. Let's be proactive. Let's understand what people need to know. And we've done a piece of work with the University of Manchester where we started to understand these learning needs. We did a significant literature search to identify what people's learning needs might be. We held a series of workshops with various stakeholders, and that included people that are working with these technologies, that included industry experts who are developing these technologies, that included senior leaders and educators in the health and care system to try to understand what we need to build in terms of education, what the learning needs, what the capabilities and skills are going to be to drive digital healthcare literacy, particularly around AI. And we've broken the framework down into 6 key areas, and we'll be publishing that within the next month. So keep an eye out for that. If you search for the Digital AI and Robotic Technology and Education Programme at Health Education England, you'll be able to find our website, and there you'll see this report published, as well as the AI roadmap if you want to go into that in more detail, or access the database, which gives an example of the types of technologies that exist within England in AI. I hope that's been helpful. I'm more than happy to have a conversation in the future for anyone that wants to reach out and wants to discuss this in more detail. Always looking to learn from others and understand what other countries are doing in this area, and therefore having an international platform like this is really helpful for us all. Because as I said at the start, we need to make sure that we prepare and we are ready, and actually we rethink the way we deliver health and care in the future to be sustainable, to be effective, and to be able to use adequately the types of technological advancements that we know are happening around us. And that is a global effort. Thank you.